Hello everyone, I am Dr.P.Keerthi Kundana and I am a pediatric neurologist at Ankura Hospital. Today I am going to talk about genetic testing. You might have heard a lot about it in the recent times. A number of tests have come up in the market which claim to diagnose the genetic disorders, which claim to detect each and every genetic problem, but it is not so. We need to understand that are a lot of limitations and advantages of these tests when used properly. Okay. Now let's try to understand about these genetic tests and genetic disorders per se. So let's also try to understand what is genetics, what is a gene, alright? Now all the human beings, in fact each and every living organism is made up of genetic material, alright? Or in other words we call it as DNA. Our body has a number of cells and within each and every cell there is a genetic material. This genetic material or the DNA is like the head office of the cell. It gives directions how that particular cell should function, what materials it should use, what materials it should synthesize, how it should function in the body. So that is all decided by the DNA of that particular cell. Now what happens that if, let me explain you in a different way. So for example, consider this book as your genetic material. This is the genetic material within the cell. Alright, this has a number of components. So this is the full genetic material. It has a number of pages. Alright, each of these pages are called chromosomes within that genetic material. And each of these chromosomes is having a number of words. So these are each individual genes within that chromosome. So hence we have around 40,000 genes which will be organized in the form of chromosomes, which in turn will be organized in the form of DNA within the cell. Alright. So whenever a genetic disease happens, there can be a defect at the level of a page. That means like if the page is torn or deleted or duplicated, so there can be at the level of chromosome, there can be a chromosomal deletion or duplication, or it can be at the level of the word, that is at the level of the gene, that this word is either omitted or the spelling is mistake or it is written twice, like that. These genetic tests are designed to identify these problems. As a clinician, as a doctor, as a geneticist or a neurologist, our job is to identify according to the features in that particular child, whatever the features of the disease are, we have to understand and predict at what level could that defect, whether it is the defect at the level of the page or the word, and the genetic test would be chosen on that basis. So it's very important that the doctor examines that child properly, the doctor forms probable diagnosis for that disease and then only orders a genetic test, because the test which is designed to pick up a defect in the word cannot pick up the defect in the page, and the test that is designed to pick up the defect in the page cannot find the defect in the word. So it's very important to choose the right genetic test, and the geneticist or the neurologist or the treating pediatrician are trained to pick up these clues in the clinical features of that child to make a probable diagnosis and order the rightful and appropriate genetic test. Then only that test can come positive for that disease. There are a number of advances that have happened in the previous years in terms of the sensitivity of these tests, and a lot of research is also going on, and in few years we will be seeing a number of more appropriate and more refined tests. Thank you.